Syncope, transient loss of consciousness due to inadequate cerebral blood flow, along with loss of postural tone. Spontaneous return to baseline neurological function occurs with no resuscitative efforts. Pre-syncope, there will be lightheadedness. One thinks he may black out. Classical vasovagal syncope. It's triggered by emotion or orthostatic stress such as venipuncture, painful stimuli, exertion, fear of body injury, heat exposure, prolonged standing. Mechanism of syncope. Global hypoperfusion of cerebral cortices or focal hypoperfusion of reticular activating system. About one third develop syncope episode in their lifetime. It increases with age and there is sharp increase seen at age 70. Cardiac syncope is occurs subsequent to cardiac arrest. Causes of syncope. The syncope causes can be divided into cardiac causes, structural cardiac disease, and non-cardiac causes. Cardiac disease includes cardiac arrhythmia, ventricular tachycardia, paroxysmal supraventricular tachycardia, bradycardia. Structural cardiac disease such as aortic stenosis, mitral stenosis, obstructive cardiomyopathy, atrial myxoma, aortic dissection, cardiac tamponade, pulmonary hypertension, embolus, acute myocardial infarction, ischemia. These are the structural cardiac disease causing syncope. Then we have non-cardiac causes of syncope such as neurocardiac syncope, vasovagal vasodepressor, situational syncope, classic vasovagal syncope, carotid sinus syncope, micturition syncope. Orthostatic hypotension is also a cause seen in autonomic failure, primary autonomic failure, which is seen in Parkinson's disease, secondary autonomic failure, which is seen in diabetic neuropathy. The other causes, such as neurovascular syncope, wherein it is seen in vascular steal syndrome. Causes of non-syncopal attack. It means episodes that are confused with syncope. These are disorder with partial loss of consciousness. It is seen in seizure, hypoglycemia, subarachnoid hemorrhage, TIA, transient ischemic attack, complex migraine, psychiatric syncope, and drug-induced loss of consciousness. Investigations done in case of syncope. ECG. ECG is done to detect any cardiac abnormality such as arrhythmia-induced syncope, wherein we see prolonged QRS, severe bradycardia, myocardial infarction evidence, pre-excitation. We also do Holter monitoring for 24 hours. Echocardiography is done. Neurological syncope. To find out the cause for any neurological disorder, we look at CT brain, MRI, EEG, electroencephalography. Then we have laboratory investigation wherein we see CBC, hematocrit, RBS, random blood sugar for hypoglycemia, electrolytes. And thus, to summarize syncope, it is transient loss of consciousness with loss of postural tone, patient falls down, spontaneous return occurs. The classical vasovagal syncope triggered by emotion, mechanism, hypoperfusion of brain. Syncope causes, it can be divided into three: cardiac, non-cardiac, and structural cardiac. And then we have causes of non-syncopal attacks. Then finally, the investigations. And this is the summary of syncope.